There it is.
Oh, there it goes.
Yeah, you got it. Good.
That's not a good one, but was that what it was? Yeah, I think well.
Yeah, probably. They must have had a meeting and well, I can see where it's staying.
Okay, so right now I have the Armin on and Ryan's on.
I'll fix it later. I don't want to mess it up. I'll somebody come back after the meeting and we can figure it. Okay.
I'll let Commissioner Devon know.
Thank you. So Dave, do I need to repeat what I already said?
Audio was captured
None?
at this point, so.
Yeah, probably.
Going back to work.
I'd start from the scratch unless you want to,
You mean do the pledge over?
well, that you could pass, I suppose. We
Okay.
did that, they could see us all standing.
Well, and that, yeah, that's one of the values is making sure the technology's working, as we're saying in the pledge. I've always figured that.
Okay, so it's now working. We're going to, okay, we'll start our meeting over again. We did do our pledge. If you were watching, we were standing. And a citizen input, we do have 2 letters today. One is regarding mask regulations.
Recording in progress.
One letter was in regards to mask regulations, and another was to outdoor lighting ordinance. So thank you for those letters.
So Madam Chair, I'll just acknowledge, so yeah, it's 9:18, and we did have a start at the top of the hour. Technical issues without the audio, but we're back online now and restarting the meeting.
Great. So, and we had no comments from the room. So we do have a consent agenda. And, Commissioner Chang is in another meeting this morning, so he was not available to be with us.
So at this time, I'll move consent agenda, 4 items. I want to thank the special road districts and the Public Health Advisory Board folks for joining our service.
And I'll second that motion. Any further discussion? Commissioner DeBonne?
Yes.
And chair votes yes. So our first action item is the intent to award the 2022 qualified pool of fuels reduction contractors. Ed, Keith.
Good morning, Commissioners. For the record, Ed Keith, Deschutes County Forester. The item I have today is the qualified pool of fuel reduction contractors. This is something that we do on an annual basis. The intent behind this is of having a qualified pool of fuel reduction contractors is so that we identify contractors that are interested in doing fuel reduction work across the county. And then as we have specific projects that come out throughout the year, we can then reach out directly to those contractors and more efficiently get those projects bid out and awarded. So that's just a little bit of the background of why we do a qualified pool. This year, like every other year, we open that up beginning in November. We have a 30-day period where folks are able to reply to this RFP. That is advertised in the public notices in the bulletin. That's advertised on our Deschutes County website where the RFP is posted, as well as being direct mailed to a variety of contractors that we've worked with, not just over the past year, but over the past several years, so that if folks maybe weren't in the pool last year, but want to get back in the pool for the coming year, they have that opportunity, as well as any new contractors that we've been in contact with over the year. There's adequate time for them to submit their information to become part of this qualified pool. This year we have 14 contractors in the pool, with 4 of them being new this year. Not new to the pool entirely, some kind of come and go as their workloads fluctuate. But we have 4 contractors that were not in the pool this year that are in last year, or that were not in last year, and then 3 that dropped off this year that were in last year. Last year, we used the contractor pool to award 12 different contracts valued at approximately $386,000. And they were located throughout the county. This intent to award basically then puts these contractors in a pool. It doesn't actually award them or guarantee them any work, but just allows them access to bid on future contracts through the rest of the calendar year of 2022. With that, I'd take any questions of anything that you might have.
Ed, what is the amount of funding for grants available for these projects, for this pool?
For 2022, the current funding that we have on hand through 3 different funding sources is currently sitting at approximately $425,000, with one large contract that I'll actually be presenting to you next week, hopefully. That's for our FEMA grant for that treatment east of Redmond. And then throughout the spring, probably some smaller projects. Then we do have one pending funding request out that we will hope to hear about that might add another $100,000 or so for work under that Senate Bill 762 grant if we're successful with that. And then, of course, we always have the potential to add more funding through other grant sources as the year goes by.
Okay, thank you.
We have a large project. Would one of these contractors partner up with somebody? Because I'm just looking at number 4, tub grinding and horizontal grinding, one contractor available, but that could be the backup service to another couple hand crew type operations.
Sure. Contractors are, usually don't, but in a larger project might, subcontract or otherwise work something out. Haven't had a lot of projects like that and haven't really had a lot of tub or horizontal grinding. In fact, I'm considering taking that out next year because there hasn't been a biomass market for that lately. If it were to come back, we would do more projects that involve tub and horizontal grinding, but we really haven't had an opportunity to do that as an activity. And thus, one of the contracts that actually dropped off was one that just did tub and horizontal grinding because we just haven't had those contracts lately due to the biomass market.
Great, thank you. That puts it in perspective, because I know that's a service we'll use for the fire-free days. That's another big contract that's not on this type of list. In fact, the contractor may be, but it's a different contract. Also, just for clarity, so this is a calendar year pool, expires,
Right.
a year from now, or 11 months from now, or 12 months from now?
Yeah, it'll expire at the end of December, and we'll be renewing that. Again, we try to, so we don't have too much of a gap here, try to put that out at the end of November. It's open through most of December each year, and then be back with you again next January.
Great.
I noticed one was out of Deschutes County, the one from Ashland. Do they do much work here?
This past year, we did award them one contract. That was their first contract in the last 10 years. That's a company that does work actually all over the western states. And sometimes they bid on projects and sometimes they don't. They haven't been all that competitive in a lot of the projects, I think because they have to pay the travel time and put their crews up somewhere. But we did award them a contract at the Eagle Crest contract this past year.
Okay, thank you.
Okay, well, with that, I'll move approval of the document 2022-045 and intent to award the 2022 qualified pool of fuel reduction contractors.
And I will second that motion.
I'd just like to thank each one of these companies for, being in business, working hard, being available for these contracts. Also, I mean, we may be in a huge upswing in this kind of work. Just the fact that the federal level, the local level, community efforts are all happening. So this is just another opportunity for these businesses to fill up their schedule and provide this service.
And then I did see on the news that a tree service company locally saved a cat the other day. So, and they said every year they get a call to save a cat, so.
Because they have the bucket trucks.
Yes.
There you go.
And the cat, of course, came down and then took off. So, anyway, thank you for saving the cat. So, Commissioner DeBonne?
Yes.
And the chair votes yes. So, thank you, Ed.
Thank you.
All right, so 9:15, we're just a few minutes late for our COVID update. There they are.
Good morning. Can you hear me?
Yes, good morning, Nahad.
Good morning. Good morning. Wonderful. Do I have all my team here? And Mike's here too. And Emily, thanks for sharing the slides. Good morning, commissioners. I just checking in with you in terms of the Facebook streaming, all of that.
Well, we've already had our technical difficulties, so I hope Facebook is working. We're good.
Yes, we're good.
Great. Thank you very much. Thank you for inviting us. For the record, my name is Nahad Satrazadi. I'm the Director of Public Health for Deschute County Health Services. Let me know if you have difficulty hearing my voice or sound. I'm joined by a few great colleagues here who maybe I'll just introduce them and they can reintroduce themselves when they give their part of the presentation. I have Emily Freeland, who is the Supervisor for the COVID Response and Recovery. I have Crystal Solly, who is our Vaccines Operations Supervisor. I have Dr. Michael Johnson, who's a Senior Data Scientist with St. Charles Health System. Jessie Terpstra also is with us. She is the brains behind the data and the slides and has done an amazing job of bringing clarity to these slides, and she has inserted some of her innovative ideas. So we look forward to your feedback on the content and the slides. Perhaps we can move to the next slide. Now, I just want to share a few take-home messages, and then the idea is that as we move through the slides, we're going to have more time on each of these messages. So if you just allow us to go through the key messages and then we'll unpack them as we move forward, that would be great. So as many committee members may have heard, as you all may have heard, there is now a shift in the containment strategy. The containment strategy was generally put in place to help reduce or prevent transmission of this virus. And we're at a point right now where, frankly, the number of cases, it's outweighed our capacity, and it has for many months. So the containment strategy has changed to now embrace strategies that help reduce hospital admissions and severity of disease and death. And I'll certainly be talking more about that in a bit. What this means for the community members is that they should not be expecting a phone call or letters or any means of communication directly from us. So the push model, where we were reaching out to the community members, now is shifting to more of a pull model, where community members will be reaching out to a call center at the state level and at the local level. There's a website here that Morgan will make available, and there's a support line put together at the state level, well capacitated, that will answer the questions and help with the referrals and so on. So that's the first key message, and that's really important for the community members to be aware of. Excuse me. The second is that testing is currently constrained. The testing capacity, the supply side of it, is very much constrained, not only in Deschute County, not only in the region, not only in the state, but nationally. This morning, I went and tested to see what if my symptoms indicated perhaps a COVID positive result, and they did. So I learned that I'm COVID positive this morning, and I did that because I, even though I know the testing is constrained, I live with elderly parents who are vulnerable and whom I might put in danger. So that was the rationalization. There are others, and Emily will get into this. There are risk factors that we need to consider in terms of getting tested, in terms of underlying condition, our age, and the need to get referral for treatment. So these are things that we need to consider at this point to prioritize those who should be tested, since we are in a rationed environment. The third message is that on the flip side, there seem to be, unless something changed since last night, there seem to be plenty of vaccines available. So get vaccinated, get boosted. I am right now experiencing mild symptoms, although I have to say, I don't know necessarily if mild symptoms is a misnomer or not. I feel not so great. It's not something that I welcome and want to have a date with Omicron. I'm assuming it's Omicron. Nevertheless, I think getting the fact that I'm boosted is tremendously helping me to withstand what otherwise could be a very unpredictable route or course of action. So I really want to encourage those who haven't gotten vaccinated to get vaccinated and get boosted. And the last message here is that hospital admissions are on the rise again. We hear that Omicron is mild in terms of its nature. Having said that, since it's very transmissible, more people are getting vaccinated, even if the proportion of those it's very transmissible and the more people are acquiring the virus. So even if it's mild, proportionally, let's say half get hospitalized, still the raw numbers are so high that it's affecting our hospital capacity. Next slide, please. So very quickly, in terms of the shift in COVID response strategy, as I alluded in the previous slide, the sustained and increasing number of cases have outgrown our containment capacity. That's the investigation and contact tracing and response for several months. And we've known about this, and we've been trying to do our best to keep up with the guidelines and capacitate ourselves. And we knew there were shortcomings in that approach, and I'm very proud of what the team has done. And at the same time, I'm glad that we're revisiting this strategy and moving forward with what makes more sense under the current circumstances. With this surge in the cases, Oregon Health Authority is leading, and we're in the midst of that transition right now, a shift in the direction of the COVID-19 response. And the overall goal is really shifting from preventing transmission to reducing severity and hospitalization. So what's embedded in this comment is that there's going to be a shift in the strategies will shift from containment towards vaccination, testing, public information, education, background services, and outbreak response. Next slide, please. So I think, commissioners, it's good for all of us. I mean, you're the public health authority. We execute on your behalf, and we provide technical recommendations for your consideration. I think there's a recognition here that there are not limitless resources, right? We live in an environment of scarcity in terms of funding and resources, and where we allocate those resources and what priorities and goals we're trying to achieve is critical. So I think based on your guidance on how you want to position the county and and the service quality that we want to provide to the community members, we will be in a better position to restructure ourselves as we proceed. So one thing to keep in mind is that we are obligated to provide wraparound services, isolation motel, and outbreak response, which are stipulations of grants that we have received and have been approved by your good selves. So those services cannot be compromised. We could say we don't want the grants and then not provide these services for the community, which would be a mistake in terms of containing and reducing, frankly, severity of this disease and hospital admissions. Now, in terms of the shift, more towards vaccination and testing, I think you're very well aware that our county has been performing remarkably well in the state of Oregon, something that we're very proud of. For us, our aim has always been to be among the top 5 counties in the state in terms of productivity and performance. But at the same time, we have to realize that if we were to look at sort of the triad of factors that contribute to our performance, if we're looking at cost, quality, and the speed with which we do the work, we cannot really optimize or maximize all of those 3 factors at the same time. So usually we optimize 2 of them with the trade-off of the other. So what I'm trying to explain here is that if we want to make sure that we have vaccination available throughout the county all the time with high quality so that everyone can access them, something has to give. And in that case is the resource or the cost of it, which means that the cost is going to increase. Now, should the authority decide that, hey, listen, we're going to really just try to optimize the cost and reduce the service, maybe to once a week, and the quality we also want to optimize, then yeah, we're able to manage the vaccination access points for our community members. But then that also might mean that we're not going to be among the top 5 counties in the state at the same time. So I just want to recognize that this is a difficult decision. It's hard to optimize all the factors. So usually there's a trade-off here and something has to give. And usually so far it's been cost, because we've done a remarkable job of increasing quality and timeliness of our services. And last but not least is the public information. Our assumption under your guidance, accurate information, and we do that through various media, as well as our support line, which is one of the best functioning units that we have, frankly, in Deschute County under the leadership of Crystal. And that's one where community members get someone locally to provide them information and support and refer them to services. So that's something that certainly we've been proud of, but I want to make sure that's on the table for discussion. So moving to the next.
Nahad, couple thoughts here. So, the time, cost, and quality triangle you're referring to, one of the points that we could see is kind of the utilization of services, as in if there's a vaccine clinic at a location and there's, X amount of employees and X amount throughput, is that being utilized at, 50, 80, or 110%, for people wanting to, get the vaccines? Because I know that's the key to the whole thing is we are available. Is somebody showing up for that service? The vaccine clinics around the county is what I'm referring to. So you probably know that number. I'm just letting you know as a, policymaker here that'd be good information to know.
Absolutely, Commissioner. I'm glad you raised this. It's a really important distinction that we need to make here, because if we set up a clinic in Bend where we can have high demand and high throughput, certainly the average cost of each unit is going to decrease, right? So we create economies of scale here. However, our job is not just around efficiency, it's also around equity. So when we set up a clinic in, let's say, Sisters or in La Pine, the unit of cost is going to increase, right? Because the demand and the throughput is not going to be as high as Bend. And that's a decision that our authority has to make in terms of which lever we're going to pull. Are we going to manage efficiency and equity, or only efficiency? Because if we're doing efficiency, then certainly there's going to be a trade-off with equity.
Yeah, and just seeing the numbers, just understanding the numbers that are happening at each location, maybe if there's a little spreadsheet that you're tracking, it'd just be interesting to know, if there was a 4-hour clinic and it wound down after 2 hours, it's just good information to understand. Because we could advocate also for those areas there. If the, vaccinated population is low, we could sure do some extra outreach there also. I'm just offering to be a partner in this. Also, on the front of having a cold in your nose, that was me last week. So I was on the remote board meeting Wednesday last week, and luckily I was able to turn off the microphone most times when I had to sneeze or wipe my nose. So I'm just letting you know that a week later, I don't even remember it now. So it really does go away kind of quick for myself. Hopefully that happens for far the majority of people, because I know that we're going to hear about the facts of complicated medical cases and hospitalizations here soon.
And Nahad,
Yeah.
on a personal note, because you do have your parents to worry about, I hope that you're, and you just did get your positive this morning, I hope you're in a position where you can actually isolate to protect those vulnerable parents. So really, it's very kind of you to be on the call today, but honestly, you know, I want you to take care of yourself. We
Yep.
truly appreciate having you at the top of public health, and I know even when my 33-year-old son had COVID a couple weeks ago, he spent 3 days in bed. So, you know, if you need to do that, please know that it's important for your health, and know that you have our very, very best wishes for a speedy recovery.
Thank you. I have to admit that I did not share this information to seek sympathy, though I love it and I appreciate it and welcome it. I have to say that I'm not unique in this. The entire health services, my team in COVID, it seems like we're all sort of struggling with this virus. There are a lot of us who are sick, and we are plowing through this because, frankly, it's hard for all of us to be off. If I see my team that's sick, still coming to work every day or remotely and doing the job, then I would feel badly to take necessarily a day off. But I have to say that that my hope right now is that the fact that I've been boosted can help mitigate any major complications. Because as I have said before, this virus, even with Omicron, it's still like bouncing a football. You never know which way it's going to go. So my wish is for everyone to be boosted and sort of play the probabilities in their favor. So, Mike, I use the word probability to make you proud as a resident statistician. So moving forward, and Commissioner DeBon, I think you made really good points. And Crystal, I would appreciate your help, especially for next week when we're planning to come to the board to have those numbers ready. So if we can go to the next slide before I give the floor to my colleague Cheryl, which is there as well. Emily?
Yeah, I was just going to add one point. We can certainly get those numbers. We track all the numbers at the different clinics and the length of time. And we're constantly evaluating how we can best shift resources and move things around. So we're meeting the demand where it is, while still providing that equity piece of meeting people where they are to get the vaccine that they need or whatever service it is. So it's something that we're constantly evaluating, and Crystal's team is working on, and my team is working on how we can shift things around and utilize the resources we have to the best of our ability and not be, wasteful, wherever we can. So I'll go on to the next one.
Absolutely. And it's really, and I want to go back to this. We're not the private sector. That's not our role. They have different goals than we have. Our goal is not to optimize efficiency only. Equity is part of that. If we don't factor in equity, I would shut down 3 or 4 of our clinics tomorrow. And I don't think our community members would be so happy with that. So I really want to put that out there and make sure we're clear on the expectations here. Our number is not, our work is not just based on maximizing efficiency. Okay, moving forward to the next slide. And commissioners, this is something that we're planning to come to the board next week to discuss. We have a current structure that responds to COVID. And this structure, there have been so many evolution of this team as part of IMT, as part of advancement and protection. And frankly, the best formula seems to be that this team functions as a standalone structure. This team right now, or what the structure you see is definitely reflective of the recent development and changes that we are hearing from OHA, Oregon Health Authority. And what you don't see on this slide right now is a team that focuses on containment, investigation, and contact, because that's no longer the main strategy for us to prevent transmission. What you see instead are obligations and areas that, as the authority, we have prioritized for our community. So, for example, equity piece on the right-hand side, community outreach supervisor, which focuses on background, isolation, model, equity. These are obligations that we have linked to the funding from OHA. The outbreak column that you see here is also obligation around schools and long-term care facility. What's not an obligation in this group, but something that has been prioritized by the authority, is the business liaison. Frankly, not everyone in other counties has this kind of relationship, whereas we have felt from our conversations, this is an area we need to prioritize and provide that consultancy to and technical assistance to our businesses in this community. So that's part of here as well. Next, you see the clinical services, and that's where we have vaccine delivery and testing, followed by the administrative part, which supports the entire operations, and the public information piece, which incorporates our support line and call center where community members can call. We have majority of these positions in place, with the exception of 3 positions. One is a manager, and one is an outbreak supervisor, and one is just logistician that we are putting in an agenda request after discussions with Nick and Greg and Eric, and bringing to your kind attention next week. One last point I want to make. This is just the baseline. This is just the core foundation. These are the limited duration positions, which can end anytime based on the need or the capacity or the priority. What really will give us elasticity and reflect the goals that you like the department to achieve is the temporary or contractor business model. So if we want to be responsive, timely, whatever criteria you put in place, for example, we want to make sure that we reach out to the businesses within 24 hours, then that's where we bring in temps and contractors to supplement the work. So if you tell us, listen, this is not an area where we want to invest in to have temps and contractors, which is your right to do that, then we would come back to you and say, okay, based on what the capacity we have, this is what can be delivered. So we would have that conversation around what can be delivered based on existing resources or elasticity of those of that capacity. So if there are no questions, I will pass the baton to my colleague Cheryl.
Thank you, Nahad. Cheryl Smallman, Business Officer for Health Services. And that's a perfect segue to the American Rescue Plan Act financial update as it relates to COVID for public health in health services. As a reminder, you approved up to $2 million expenditure related to temporary staffing to support the COVID response and recovery efforts, as well as wraparound services. To date, we've expended $1.5 million, or 75% of that, which you can see on the bottom left-hand side of the screen. Looking at the average weekly expense for the month of December, it was averaging $63,000, which is slightly up from the average weekly expense in November. I suspect that's primarily related to holidays and scheduling of temporary staff, which is why that was lower in November than it was in December. So projecting forward at the current rate of $63,000 per week in temporary staff, that would last us through late February. As Nahad mentioned, we are evaluating the ongoing need and will present options to you in probably 2 weeks or so. We're working on a phased-in approach based on the shift in guidance from OHA. So I suspect in the coming weeks we'll have those options in discussion forthcoming. And with that, I will take any questions related to the finances.
So Cheryl, if I remember correctly, at one point, I thought we were at like 32,000 a week, and then we were at 52,000, and now you're saying that we're going to stay at the 63,000?
That is what is being evaluated in terms of options. We have shifted some of the temporary staff to support the call center, as that is part of the shifting guidance from OHA. So we are looking at how much is needed at certain service levels, and we'll bring that to the board for consideration in terms of if you want to continue funding it through the American Rescue Plan Act funding, what service level you can expect at what weekly amount.
Is the call center being operated with St. Charles? Or is it our call center by ourselves?
I'm happy to speak to that since I've been with the call center from the beginning. So in the beginning, the call center was a joint effort between St. Charles and Deschutes County, but it has been solely a Deschutes County operation since about March of 2021 and continues to be supported just by Deschutes County.
Someone was suggesting to me that because our numbers were so high, what is it, we had 3,600 last week, that really we should be running it 7 days a week. Has that been considered? I mean, then of course we have to remarket it and say, you can call this number any day, but you know, if someone's getting a positive test, they truly need to know that they don't want to just sit on their couch. There are therapeutics that they can do that I would hope you would be sharing with them.
Yes, and later in the presentation, we have a breakdown of kind of what we're doing with the call center and what availability we have to the public, which we have expanded in the last week or so.
Okay.
Right, and I just want to add, Commissioner, that's actually the point of the discussion next week and the week after, in that should the authority, your good selves, decide that you want to have a 7-day week operation, then we would build our capacity with hiring temps and staff and be able to have that service available timely 7 days a week. But it comes at a cost. Should we decide to do it 5 days a week, then there's a different cost. So these are the options that we'll bring to your good selves for you to make those decisions.
So this is our COVID update bi-weekly. I think of this as the business of, the back-end business of the county. So I'm just, in the next time we bring this around, let's put it on a separate agenda item.
Right.
Because, I mean, I'd like to get deep into this, but I don't know that this is the right place to, keep going on this topic. Let's hear about, the medical system is next.
Good morning, everyone, and thank you for your time. My name's Mike Johnson with St. Charles, and been working very closely with everybody else that you see on this panel for quite some time now, and I appreciate all their expertise and our collaboration. We've pared down the slides a little bit for you this time around, focusing on just a couple of topics. The first slide represents the proportion of beds that are filled with COVID patients of the total number of occupied beds. And you can see that there's just a tremendous amount of variability, and you can identify also the surges in there. Currently, we're sitting at 15% of all of our beds. This is a weekly average, by the way. In the most recent week, 15% of our ICU beds have been filled with COVID patients, and 29% has been the ICU beds, and 15% the non-ICU beds. I did want to highlight the fact that with the unique characteristics of the most recent variant, of it being, quote, less severe, it does impact different elements within our hospital system and different departments. And so the emergency department visits, we're just expecting to go quite high, almost a 50% increase over what we saw in Delta. And that dotted line is if we continue on our current trajectory. So we're almost right at we're right at that 729-ish visits already this month. And we just expect that to go up. And it's also, this is even more pronounced with the pediatric cases. They're going up about 75% above what we saw in the Delta surge. So just another area of resources that are being stressed more so with Omicron than Delta. Next slide, please. And here are the raw numbers on those pediatric cases. The blue line at the bottom, you can see the projection is for 16 hospital admits this month for our pediatric patients. You know, everybody is talking that, you know, we are looking at just Omicron. And, you know, I think it was brought up, you know, in a previous meeting that there still is some lingering Delta out there. And so it's not just wipe the slate clean and all we're looking at is Omicron. It's just very difficult to sequence this to the point where we know exactly what the proportions are. But most of the models, although that you don't hear about it, I still have some Delta variant that is acting within my predictive model. And I think that that's actually the case. And anecdotally, you can talk with 5 people out there and some have incredibly mild symptoms and some have incredibly devastating symptoms. And I don't know, all I'm saying is it's very difficult just to say, oh, it's you know, one or the other. But we are seeing the effects of both, I think, for another week or two. Next slide, please. So we are seeing considerably more breakthrough cases for those who are have been vaccinated or even boosted who are getting infected. But thankfully, it is still having a very, very positive effect on reducing the number of hospitalizations. You know, we really do, for a reason, sound like a broken record. But the vaccinations are a good route, and it is definitely having you know, the more that we can get vaccinated and boosted is going to have a good effect on helping us survive this. You know, with regard to the hospital system. So just a couple of points to leave you with. The peak for Oregon, if you go to the OHA site, they're going to show that to occur, you know, in the last couple of days of January. Maybe that's moved to the first couple of days of February. I'm not certain. Peter hasn't published his most recent modeling efforts. That'll come out tomorrow. But here in Central Oregon, I'm not seeing that occur, that peak occur until about mid-February. And I really don't have any reason to change that that forecast. So it looks like whatever we've been experiencing here in January, we have not yet seen the full brunt of this surge. And even optimistically, it's going to be into that first week of February before we see any kind of relief. We do evaluate on a daily basis, you know, how many cases we have in the hospital and how many elective, procedures we're able to schedule for that coming week. And we're doing everything we can there. But we are, you know, everybody I think has read in the papers about our staffing shortages, and we have a tremendous number of caregiver positions that are open as well, and many of those being nurses. But on top of that, we are also quite stressed just because of so many positive cases for our caregivers. We had like 283 positive cases just in our hospital system. Currently, there's 68 active furloughs. That number of furloughs has been as high as 90 this month. So those are completely removed from the workforce for that period.
Dr.
So that's
Johnson, how many?
It's hitting us as well as every other agency that's around and every other element within the community.
How many, Dr. Johnson? It's Commissioner Adair.
Yes.
How many nurses did we lose because they weren't vaccinated at St. Charles?
I can find that number for you. I don't know. I have heard in conversation that it was actually much lower than some had anticipated. But I honestly can't give you that number now without researching it. But I'll make a note.
And then, did you notice this week that the NCAA actually acknowledged the natural immunities from people who have had COVID? I believe that was a new ruling from the NCAA.
You know, we've known for quite some time now that, you know, the strongest immunity comes from this menagerie of you know, elements. So to be vaccinated, to be revaccinated, to be boosted, to, you know, to be infected, getting a hybrid immunity is definitely the strongest. But, you know, what continues to be consistent is it doesn't matter what kind of immunity you have, it's not going to last forever. So, I mean, if you've been infected and you've been boosted, but you got infected in 2020, you probably don't have the same level of immunity as somebody who was infected in December of this year. So, and then on top of that, you throw the heterogeneity of this whole virus and how it affects each of us differently. So I don't know. I completely agree with you, and I'm glad that they're recognizing that. And but it's not to the point now where I say, oh, I should go out and get infected because that's going to give me stronger immunity. I still don't think that that's a good course of action. However, with this current surge, we are going to see more of our population with a hybrid immunity, which is actually a good thing if they can, you know, go through the process like many of them, even some on our panel are doing today. So, but thank you for highlighting that. Super important, and what might allow us to at some point see this transition from a pandemic to an endemic. But
thank you.
Mm-hmm.
So barring any questions for Dr. Johnson at this point, I'm going to move on to some of our local data. Again, for the record, I'm Emily Freeland, COVID-19 Response and Recovery Supervisor. We've changed our slides a little bit, so you have a little bit of a different view, but some of the same data that we typically present. So the first thing we're going to talk a little bit about is our average daily cases and compare that to last week and then this week's cases. So our cases are continuing to go up. We see last week we had about 3,500 cases diagnosed and brought into our system, and this week we had 4,500. So that's up about 26% over the previous week. So that surge is certainly continuing. If you look at that per 100,000 population, this week we had about 2284 cases per 100,000 population, which compares to the statewide average of 1,303 cases per 100,000 of the population. So we're continuing to surge, and the state is as well. As you can see that the number has gone up statewide by about 300 cases per 100,000 population. Oh, shoot. Uh-oh. Okay, so as far as testing, we've had lots of questions about what our testing volumes are, what our testing accessibility is, how many tests are we doing in Central Oregon as compared to other places. So this week, we ran, as a community, over 2,400 tests per day, which is about 882 tests per week per 10,000 population, which compares to the statewide average of 751. So I know that that's one question that we've had pretty often, is how we compare, you know, to the state and what our accessibility is. And we've talked a lot about purposeful testing. So encouraging purposeful testing in places like Nahad, you know, there's a very strong reason where he went and got tested this morning. He wanted to know that information so he could, you know, make choices that would help him protect his elderly parents who live with him. Whereas perhaps someone else who like myself, I work from home. I don't interact with elderly people. If my kids were sick and one of them was diagnosed and then I also became symptomatic, me seeking out testing in that circumstance probably wouldn't be information that would change anything about my behavior, right? I'm already staying home. I have the ability to work from home. I would keep my kids home. I probably won't qualify. I don't have any underlying conditions. I'm not going to be able to seek treatment. And therefore, staying home, weathering the illness, and then going back after my isolation period to normal behavior would be something that I would do, whether or not I got tested and had that positive test as a confirmation. So I think we've talked a lot about, we feel that our population in Central Oregon has done what we've asked. We have told them, please seek testing if you're feeling sick. Seek testing if you know you had an exposure. And I think we can see that borne out in our numbers and our, increasing demand as more and more people are symptomatic. But we are encouraging, people to make those purposeful kind of decisions as to when they're seeking testing. And Crystal will talk a little bit about more about where you can get testing and possibly how you can get some at-home test kits so you can, be able to get that information for yourself at home without going out. Our test positivity this week was at 26%, which is slightly up from the previous week at 25.5%. And also, again, slightly higher than the statewide average of 22%.
Thank you for those numbers showing that we actually are testing like almost 20% more than the rest of the state. So that, when people ask, our numbers are so high, and they truly have been high for quite a while. Okay, when you see that, that does explain that a bit. So thank you.
Yeah. So it's not all, all of these things are multifaceted, and there's many variables that are, affecting why, Deschutes County may be different from our neighboring counties or counties throughout the state. But I think that is part of the story, is that people are seeking testing at a higher rate, and we have it available. So right now I know that there's some frustration around people not being able to get tested exactly when they want or in the, mechanism, and it's not as easy as we would like. But as compared to some other places in the state, we know that the testing availability is greater. So the next thing we want to just go over, and we've, condensed this down a little bit too, is the vaccinations that we have by age group. So 17 and under were about 46% of those people, however, received at least one dose of a COVID-19 vaccine. From 18 to 64, we're at about 78%. And then 65 and older is pretty much fully vaccinated. So we know that there's been some confusion around that. 100%, is that accurate? This is based on denominators that come from yearly standardized information that we use through the Oregon Health Authority chooses, what those denominators look like based on yearly updates. So we also wanted to throw in some information about vaccination by race and ethnicity. And we can see here that there's some really huge variation between different populations within our community. This is one of the equity lenses that, Nahad has talked about, and where we spend a lot of our effort is trying to, decrease these gaps. So a couple things to note here is, clearly some of these groups in Central Oregon and Deschutes County specifically have a very low denominator. So the number of people that fall into these groups are very small, and sometimes, one or two vaccinations within these groups can make a big difference in the number that we see vaccinated. Clearly, the lowest group in this chart is the Hispanic and Latinx group, and after white, that is our largest, denominator, or our largest group of people. And we work hard to do outreach and, specific vaccination clinics to help bring that number up. And if you looked at this number from several months ago compared to now, you'll see that there is a big difference, and those outreach events and specific targeted events are making a difference in bringing this number up. We'd also like to just acknowledge that a lot of times it's not just about, information and educating people, which is certainly part of the puzzle. It's also about access. So making sure that people have access at times and places that are convenient for them, As if I'm working several jobs in areas where it's hard for me to take a couple hours off to go get vaccinated, you know, that's going to be a barrier that's hard to overcome. So we really try to put that equity lens in when we're choosing and how we're choosing to increase our access points. And like Nahad spoke of before, that you know, sometimes the cost per unit in those events or at those times is going to be higher, whether it's a rural community or a specific demographic that we're trying to serve. We do want to make sure that those access points are there so that if people choose to get the vaccination, that they have the availability to do so. Nahad, is there anything else you'd like to add here? Okay. So this kind of shows our vaccinations by zip code. We can see that the lower, like the lighter blue color is a lower number of vaccines per 100,000 population, and this dark blue is a very high number. So, you know, we have varying coverage across our county, but most of our county is a dark blue, which is a good thing. Means we have lots of vaccination coverage there. So our vaccination volume has also been fluctuating over time. We can see in the last couple weeks, we have hovered around 6,000 vaccines being administered per week overall, and Deschutes County is, you know, administering somewhere around, you know, 10% of those. So this is kind of where we want to be. You know, we have this distributive model on purpose. We want people to be able to access vaccines through their providers, through pharmacies, through clinics that we put on. There's lots of different avenues for people to access vaccines, and we want to be able to target our time and effort to making sure that we're the kind of provider of last resort, so to speak, or, you know, that safety net where we're really targeting specific populations or places where there's difficulty, or like we saw kind of before Christmas when there was really high demand, that we're expanding our clinics to help, you know, ease that demand so that our providers can do their job, our pharmacies can fill prescriptions, all of those kinds of things as well. So it's kind of a combination. So I'm going to pass it over to Crystal, who's going to talk a little more about all of our operations pieces.
Thanks, Emily. Good morning, commissioners. So we're going to delve a little bit into what we're actually doing to meet these goals that we have as we transition into this new model. So vaccination, what's available, where can people go? We have so many community partners who vaccinate other than just Deschutes County, you know, standing clinics. So we encourage folks to access all modes, whatever is most convenient for you to receive your vaccine. So going to vaccines.gov is a good way. Going to our Deschutes.org COVID website, it's going to be updated with, you know, things like changes in our pop-up clinics, additions of FEMA and OHA vaccine assistance that we utilize in our county. So going to those websites is really the best way to find the right place for you. Go ahead and next slide. And then testing, what is available, when and where. I think Emily kind of hit the nail on the head of, you know, we want what we want when we want it, right? And that's what we're very much used to in our culture. But I think that we've shown that we've really increased the testing availability that we have in the community, and that we need people to make smart decisions about when they're testing, which is different than what we've been saying all along. So, you know, really partnering with the community to look at this in a different way. So calling your medical provider to schedule a test. Many of our providers have really upped, you know, their testing and vaccine game to help our community. We have 3 curative sites, 2 in Bend and 1 in Redmond. They are by appointment only in curative.com. We would encourage people to check multiple times. If they have cancellations, they actually add appointments. So that's a good way to keep checking. Urgent cares, those rapid at-home tests. If you haven't ordered your test through the Postal Service, we would encourage folks to go do that. You get 4 free tests per household. And even though we're kind of in the midst right now, and those tests would be really handy to have right now, we don't know what's coming over the next few months. So we would encourage everyone to get on there and order their 4 free COVID tests for their households. And let's see. Did you want to add anything about testing, Emily? Okay.
Real quick, I had sent a note, and Dr. Conway had responded. Maybe, Nahad, you can help clarify the terminology, but I had asked about these, at-home tests. If there's, an evolution of the virus, if it's changing over time, are those tests going to, lose their validity? And he mentioned that, there's a level of the test where it'll probably be a good test for a long time, even if it does evolve. So, as I say, I don't know if somebody wants to help me with the terminology there, but that was the concept.
Yeah, I would just add that, those at-home tests, those rapid antigen tests, they're certainly not as sensitive and are not going to pick up, as many infections as, these PCR or these molecular tests that we talked a lot about that you would probably access through a provider. However, they have been shown to be able to pick up the Omicron variant if people are sick with that. And they probably will for many other variants as they come. They're certainly not as sensitive though, and it depends on when in your illness you're testing. So they're the best at picking up infection in symptomatic people, and typically not immediately when your symptoms start, but just a little bit after. So we hear often that people will test with these like rapid antigen tests, right when they start feeling sick, and they will test maybe negative at that point, but the next day they'll test again and that will come back positive. So this is another reason that these typically come in packages of 2, so that you can do a couple of tests, maybe 24 or 48 hours apart if you're symptomatic, to help with that sensitivity. I would also add that, we want to encourage people to take those and then call if they have questions or they need more information about what that means for them. So certainly we want to encourage people, if they've taken an at-home test, to reach out for information if that's something that would be helpful.
Thanks, Emily. So speaking, to that piece, Commissioner Adair, that you brought up about people who, they might test positive and they need to talk to someone. So since the beginning of the pandemic, we've had our local public information line, and now we're really excited to have help from OHA. So they have utilized the shift in our model of taking care of COVID in our community. And they have created this OHA hotline. So the number is here for people to call. So if you're testing positive and you're not sure what to do, you have questions about isolation and quarantine, or you're not sure what to tell your friends who you just unwittingly exposed, we would encourage you to call the OHA hotline that's listed here. For those more complex situations or for additional local services, we've still got our hotline in Deschutes County all set up. And we've taken some of our staff from case investigation and contact tracing to beef up our abilities of the hotline so that we can help those who need wraparound services or isolation out of a congregate living situation. So we're still here on the hotline, but we also have this resource that we really want people to take advantage of, the OHA hotline. So what we did in terms of hours with this for now is to mimic the hours that the OHA hotline is open. So traditionally our hotline has been open Monday through Friday, 9 to 5. We've changed that to Monday through Friday, 8 to 6, and Saturday from 10 to 4. And we actually do have people staffed on Sunday to listen to voicemail messages because we don't want anyone to get lost in the shuffle of needing assistance with isolation and not be able to get a hold of anyone. So we're open the same hours. So if OHA has a call that is beyond them and they need to access local help for that, they'll transfer that phone call to us. And I think the point that we want to get across to the community is there's no wrong way to access services. If you call one of these numbers, we're going to get you to the right place. So next slide. And then, so in expanding our hotline and encouraging people to call OHA, something that we want to make sure that we take care of locally and that we have a responsibility to do is support outbreaks and help our community partners manage them. So we're looking at infection prevention, risk management, support for entities, high-risk populations. So these are our long-term care facilities where our elderly, hopefully 100% vaccinated, but very vulnerable population is. Congregate living situations. So these are schools that we have in our community that are boarding type schools, homeless shelters, adult foster care. We have a lot of these congregate living situations, and if we have an outbreak, those are the cases that we want to make sure that we capture and support appropriately. Schools and childcare, daycare settings fall into those groups as well, and food chain or agricultural facilities. And next slide. And as always, we're trying to couch information from lots of different directions for the community to access. So we've got our Deschutes.org website that we update regularly with new information. People can email the health services at Deschutes.com or .org, if they have specific questions. Or calling the hotline. So we're hoping that we have nice wrapped support for our community as we move into this, as we move into this different way of management. This is definitely a time of high transition. And so we expect to have things tightened up even more over the coming weeks.
So Crystal, shouldn't you add the Saturday call service too on that slide?
I did. Yes, I just noticed that. I was like, no.
Yes.
So we'll expand the hours to make that accurate. So again, Monday through Friday, 8 to 6, and Saturday, 10 to 4.
Thank you. Now I can let the person that gave me the suggestion know that it actually has happened. So thank you so much. Thank you, everyone, for the update. Any other questions?
No questions. Thank you so much.
Yes, Nahad, get better. Take care of yourself.
Thank you. Thanks for your kind words, commissioners, and thanks for your hard work. Take care.
No. Okay, so legislative.
Thank you, Commissioners. For the record, Whitney Hale, Administrative Services. We're joined this morning by Phil Shoyers, who you see on Zoom. I think Ryan Tribbett from PacWest Lobby Group might be joining us as well. We are here this morning to check in with the board about the upcoming legislative session. And so I will turn things over to Phil to get started in that update, but he's planning to just connect with you and provide an update on what he knows and our upcoming timelines for the upcoming session. So Phil, go ahead and take it away.
Thank you, Commissioners, and thank you, Whitney. Can everybody hear me okay?
Yes.
Okay, awesome. So yeah, just wanted to touch base this morning and share with what we are hearing coming out of legislative days. If it's okay, I would like to just kind of start with a political update. Some of that stuff you folks already know. We had a good conversation via phone with Representative Rayfield last night and got a little bit more information that I can share with you. And really the purpose of this the front part of our conversation again is to just describe the playing field or the landscape that we are going to be navigating through here in the next 2 to 4 weeks. As you folks know, that short session is really pressed, deadlines start right away. And so right after that political update, I'll go over that timeline so that we're aware of the deadlines for legislation moving forward. So first, just wanted to give a quick update on political turnover. As you folks know, there's been a lot of that occurring. In fact, as of, I think, yesterday, we just hit 9 new members just since the last adjournment of last session. And then we just crossed the 20+ threshold of legislators who have either announced that they are retiring or running for other offices. So that is a significant difference from past short sessions that we walk into. Part of that difference is where those turnovers are occurring, and that is all in leadership. Effectively, while we're talking about the 2022 session, what we're going to be seeing is that that has changed the perspective of leadership, because we know when we go into 2023, for the first time in decades, we will have a new governor, a new Senate president, a new House Speaker, new co-chairs on Ways and Means and Capital Construction, and several policy committees. That leadership has been very stable and in place for a long time, especially on the Senate side. And then, as you know, Speaker Kotek has been the state's longest serving speaker as well. So having that that big turnover is going to really change the dynamics we go at legislative priorities from. Specifically is education. It's going to be re-educating and re-educating and re-educating about what Deschutes County is, our priorities, especially since with our conversation with now coming in Speaker Dan Rayfield. Part of his philosophy is he doesn't want to go back and continue tapping the same folks for leadership positions. So you're going to see him promoting freshman or maybe sophomore class legislators into some chairmanships. Again, I would go right back then to re-educating them about what makes us different in Deschutes County. Yes, we're part of Eastern Oregon, but we kind of have very unique situations. And we are definitely, we don't see ourselves as the western part of the state. Helping them understand those things is going to be very important. And so, what do you call it? And I apologize right now. I have a puppy that's mending a broken leg right next to me. So if she barks, I apologize. What do you call it? So part of that leadership turnover is, like I said, in the Senate side, we're going to have Senate President Courtney through the short session, but you're going to see leadership decisions probably being pushed from Senator Wagner. Rob Wagner is currently the majority leader. We have visited with him and have had good conversations on priorities towards Deschutes County. I did not say that courthouse is our top priority, but we have just flagged he wanted an idea of what we're looking at. I mentioned that and how we some of our priorities from last session, and he was still remembering those. So that's a good thing. On the House side is where you're going to see a lot of the turnover. As Tina Kotek steps down as Speaker here on the 21st. They've already had their caucus leadership elections this last week. You will see Representative Rayfield move from our co-chair position on the budget to Speaker. Senator Julie Fahey, Representative Damone, she was on our housing chair. She has now been elected majority leader and will be driving the caucus agenda there. That is semi good news for us. I think she is much more of a pragmatic leader, very much of a building consensus through work groups approach. There were some in that election cycle that were much more progressive in the view of just pushing votes rather than working through work groups. And so I think we did get a good a better choice there for majority leader that we can work with. And then you will see Nancy Nathanson stay as revenue chair. But for that new co-chair position, we are hearing that is going to be Tanya Sanchez out of the Portland area. She is very close to our tribal members. And so that is a big focus for her. She also is very focused on human services. So we will be scheduling meetings with her to just get on her radar as we move into session. But that will be a new position for her. She sat on a subcommittee for the first time this last session, so this will be a very big expansion to what her responsibilities are. And then on the Republican side, we also have seen a change since our last meeting with Vicki Breeze Iverson taking the helm as our House Republican leader, Tim Knoop taking the helm as the Senate Republican leader. And then you will have on the House side, Representative Greg Smith also helping on the budget side while Vicki focuses on policy. And so we have good relationships with all three of them. We had a good meeting with Vicki just this last Friday over here in the Valley. Just to bring her up to speed with our work with Deschutes County in the past. And she seemed very helpful and willing to receive what we come up with as our next legislative priorities. I just wanted to pause there before I moved on to the next conversation. Is there any questions about leadership turnover or anything like that? All right. Well, then I am going to share my screen so that you can see the timeline here of what we are looking at for short session. Here we go. Here we go. Perfect. All right. Does that pop up for everybody?
Yes, thank you.
Perfect. Sorry, I just had to change my settings there. So this is the condensed timeline that we're going to be walking into for this short session. Last week, we received, we passed the first one, which is under January. You see we have legislative days, the 10th through the 13th, but the 14th was the key deadline for legislative concepts to be submitted to the chief clerk's office or secretary of Senate's office. Now that's important because that's when they're assigned bill numbers. In Bill Tracker, I have put a call in to see if they are going to be able to pull those into the system before February 1st. Last time it's a linked system to the chief clerk and secretary of state's OLIS pages. So if those two offices choose not to upload them until February 1st, then they will not upload into Bill Tracker until then. And so what I am currently doing, and that should be in your inbox, or at least Whitney in your inbox today, is I've gone through all of the committees, listened to them, and I have put at least an Excel sheet together of the LC numbers we know. Every committee had 3 bills that they could introduce. I've put those in there. I am just going to try to prioritize them a bit of, hey, these have nothing to do with Deschutes versus these are things that affect local government in general. And then these are items that might affect Deschutes very directly. And so those will be completed today. And fortunately, it won't include all of the member bills because not every one of them, not every legislator talked about what bills, the 2 bills they're introducing during legislative days. So those will become public when they're published in OLIS, but it does get us a good head start so that we're not trying to tackle a huge list of bills all at once. So that deadline happened last Friday. The next key deadlines are in February. Actually, I'm going to pause there. One that I don't have here between January and February, you will see, is that as Dan Rayfield comes in as new speaker, he does have the option to change committee assignments around. And traditionally, we will see what those committee assignments are here either next week or the week right before the legislative session. And so there's from what our conversation is, he is not looking to change things dramatically. He's not looking to upset the apple cart. He thinks things are working in process current as much as possible, but he is going to be reviewing some of the restrictions regarding presentations during COVID, building access, things like that. He's not promising any changes there, but he says he does want to review them as he's coming into that leadership role. So that should occur next week or the week after. Now going right into February, sorry, and that's not on this page, but going into February, you'll see we have a very tight timeline. The first deadline happens right at the 7th of February. We begin on the 1st. The 7th is what we call the chamber post work session. The first chamber post work session, that is every bill has to be, if it wants to continue, has to have a work session posted. Doesn't have to occur by then, but it has to be posted on the agenda, or that bill in these policy committees are considered dead after week 1. That same week, so that's the 7th of February. 2 weeks from there, we have the 14th, and that is where it's the first chamber deadline. So those have to be passed they've had to have received that work session, and then they had to have been on the floor and voted and on their way to their second chamber. And so for folks listening, when I say chamber or first chamber, second chamber, if it's a House bill, then the first chamber is the House chamber and has to proceed on to the second chamber, which would be the Senate, and then vice versa on if it was a Senate bill. So again, the 7th, you have to have it posted. By the 14th, it has to have been worked, voted on in the first chamber, received the required votes, and in the second chamber's hands. Then just right around that 1 week later, after it arrives in its second chamber, it has to have a work session posted over there. And then by the 24th, which is really just 2-3 weeks into session, it has to have gone past the second chamber. So that is a very, very tight timeline What we are hearing, at least from the House new leadership, is they have several items that they know they want to address that are going to be big lifts, but they are not looking to take on any large tasks that have not already been discussed in a previous session. They don't, they just don't have, they are taking the view of that's too much of short of a timeline to tackle big policy like that. And I'm going to get into some of those items that they did say are heavy lifts, but I just want to go through this timeline real quick with you. And then finally, they plan to adjourn in March.
We have a question here real quick.
Yes, sir.
Phil, this is Nick Lelak. Just a quick question. Last night at the Redmond City Council meeting, the Central Oregon Cities Organization lobbyist Doug Riggs mentioned that there is talk of pushing back the start date of the session. I'm just curious if you've heard that, if that's likely, and obviously then it would translate into changes in your schedules. I'm just curious if you have heard that as well.
Right. No, that's a good question. I have heard rumors of it. From my conversations, or from Ryan's conversations with Representative Rayfield, that they don't intend to do that, because one of the questions they would have to do have to address on that is these dates have been set in legislation passed in the special session, so they would have to come in start session, pass a resolution changing these deadline dates, and then probably recess or go back out to get whatever time they need. But and from my understanding is that was too much of a rocking of the apple cart, or turning of the apple cart for them. They just wanted to proceed as normal as folks are expecting. Now, given this year, it is a flip of the coin. What I just said now could be different in 10 minutes. Things are changing frequently, but from what we talked about last night about 8 o'clock on the phone with him, that is not what he's wanting to do. I don't know where the Senate president lies on that issue, but I do this. The new speaker is not looking at that. So if that's helpful to know.
Yes, thank you.
No problem. And so then I do want to note that there are a few committees that do not have to adhere to these deadlines, and almost all of them are joint committees. So anytime we have a joint committee, they do not have to adhere to the timeline, because one is, if it goes through those committees, they can go straight to the floor. They don't have to go to another committee once you get onto the other chamber. And then rules and revenue. So joint committees, rules committees, and revenue are the three main buckets of committees that don't have to adhere to these timelines. They can introduce bills at any time. All of the policy committees have to follow the timelines, and they cannot introduce more bills. So right now, I think the last time I counted in the House, there's 23 committees, and only the rules and revenue would qualify on the House side for the unlimited bills or no timeline. So, and same on the Senate, I think they're just short of 20 committees on the Senate. So there's going to be plenty of movement of bills. What we know that leadership has said is a top priority for them to pass this session is one, and this might, I'm just throwing these out there, they might not be Deschutes County priorities, it's just what they have said they are interested in moving forward. Heavy lifts. One is ag overtime. They had a significant hearing this last week. I know you commissioners, this is a very ag-based county, so you might be hearing conversations or being asked about it. What was presented was in the majority's eyes, a compromise where they will offer a phased-in approach of ag overtime, and then in addition offer, I believe it was 50% tax credit for any wages, which I will have to say, I don't think I have seen in my 12 years of working with the legislature in it, that the majority party has offered a tax credit for wages. That's just usually kind of a taboo tax credit for them, but they are offering 50% tax credit for any wages over the 40 hours, and then that will phase out over years. I think like year 5, it drops down to 25%. They feel like that's a middle ground approach. It was not received as a middle ground approach from opponents of the concept. So it will be a robust conversation moving forward. But they do, everyone we've talked to in leadership has said that is on their agenda to pass this session. It may look different than what they proposed just this last week, but it is in their mind. The other one related, and this might not be as important to us, is just they do want to reinstate the harvest tax and modify it, in their mind, modify it to being up to date with all of the priorities that the government has in Oregon. But they have not really given a lot of detail on that. I have a one-pager from the Revenue Committee, but they've already stated that there's going to be changes to that. Since they don't have to adhere to timelines, they are going to have a little work group start to meet here right before session and at the beginning of session. So that one pager, if you would like it, I'm happy to provide that, but just know that it could look different after the work group.
So harvest tax referring to timber revenue, correct?
Correct.
Timber. Yep.
Correct. Yes. And part of that will also be implementing items that were in the private forest accords, which I'm not as familiar with, but that has been making a lot of headlines right now within the legislative conversations and discussions, but that will be folded into this harvest tax. Now that will, the other discussion around revenue and tax credits is, what I'm going to move in next is there's going to be 5 major omnibus bills that that they are seeking to move. One is obviously just a budget rebalance that is going to start moving quickly at the front end of session, and then maybe slow down a little bit. But traditionally, that's one, like maybe week 2 or 3 where that starts passing. And there's going to be a lot of healthcare conversations there. What could hold that up is discussions on whether the federal government passes another package. I don't think, just seeing what we've seen in the past, that they can get that out the door at the federal level before this session adjourns. So you're probably looking at another special session if they pass something on the federal level, and that special session would be to receive those funds and allocate them in whether that's to agencies or to, like has been in the past 2-3 special sessions. But that budget omnibus bill is going to be there. We are going to have an emergency prep bill that that is going to have multiple concepts in that. We are working or had good conversation with Representative Paul Evans, who is spearheading that. It's going to be a committee bill, so they have intentions of passing it. It's going to include technical fixes, more conversation about standing up the emergency management division of the military department as its own agency. And they are still looking at putting additional things in there. We do have a commitment, though, from Paul Evans that he is putting a one-pager together of items he knows will be included, and he is going to share that with us. And as soon as we have that, I will share it with you folks. They are just in the process. They know on day one there's going to be amendment to the bill, adding things in. So he wants to make sure that he gets everything in a one-pager on the front end, which I appreciate, because then that we know what's happening. Item number 3 is a transportation bill. We don't know what that looks like right now. It was introduced by the 2 chairs of the Joint Transportation Committee. They discussed some items that they want to include in that. I will have that in a bulleted format for you, but there's going to be additional items in there depending on how the ODOT Commission, they're having meetings with the ODOT Commission regarding the federal funds that have come in. And again, if there's any additional funding in the next federal package that's targeted at moving Oregon's transportation system into a more green transportation system. That's where the conversations are currently being held up, is what does that look like? So a lot of it is also talking, there's a portion in there that allows local governments to impose additional taxes or franchise, I don't know if franchise fees are the right term, but a fee for helping modify public parking spaces, things like that for electrical vehicles. So that will be included, but it is a hot contested issue every single time. So I can get you what the current conversation is going, but that again will be changing as those committees meet. And then the last 2 that I think are going to be probably more important to us as well is there's conversations of whether taking that harvest tax and putting that into an omnibus tax credit revenue bill. They have a couple of revenue fixes that they need to occur. One is related to school finance because of the wildfires, now that they have more data. One is talking about lost revenue to businesses due to COVID, whether that's going to be in the form of direct allocations or tax credits. And then also I believe they're looking at some modifications to the rural healthcare tax credit, not in a bad way. There was just discussions of whether we can, I believe by Representative Nose, of whether we can increase previous 10% allocations to providers up to 20% just during this time. Part of that is they're wanting to get these ARPA funds that the state still has out the door before deadlines. And I think that's where some of those conversations are going. And then last night is where we learned about the fifth one. Rayfield is interested in doing a rural Oregon investment package. He doesn't know what that looks like yet. He is asking us to put ideas on the table for him, but he is interested in doing that this session, whether that's through bonding and capital projects or whether that's through ARPA funds that might be remaining on the table. If we go that approach, it's got to get the governor's buy-off. But he has told us to start thinking about incentives for rural Oregon that might be beneficial that we can include in this package. And so I wanted to put that on your mind so that we can start thinking about it. But we don't know what that will look like. I anticipate that will come through the Capital Construction Committee, just because there's not a bill number currently associated or a bill vehicle, and Capital Construction he will sit on and have a say in the matter. So
let's talk about that real quick. So
I'm going to pause.
Yep.
Okay.
Rural Oregon Investment Package.
Yes.
And
yes.
I mean, I think of housing needs as the first thing, which backs up to maybe system development charges, water, sewer, roads for existing cities, or any kind of infrastructure type thing. That's maybe a path down that whole concept. Is there what other palette of opportunities could we be thinking of when you think of investment package?
Well, one of them is we might be looking at homeless services that meet homeless needs. I know that Representative Jason has a bill that we already have submitted a letter for that includes areas for additional. I don't think navigation centers are the right term there because that was the previous bill, but similar centers for consolidating of services. They might be expanding that into additional areas. I know that bill concept currently has 8. They're looking at maybe adding more. I think if you are also trying to
let's talk about. I'd like to talk. I mean, that bill. Yeah. The definition of what that is still to be defined. I want to be a partner in it. We want to figure something out. But if we're just gonna hire people to open the office of, and I mean, I don't know what that means yet. I just don't understand what the vision is. And this is the tricky part. You say, oh, those homeless and these addiction issues and that criminal, or that poor family that doesn't have housing. I mean, your brain goes in so many different directions when you bring this topic up. And so let's take some serious, clear time to work on, okay, what are the definition of what we're trying to deal with and what are the possibilities of change? Because man, let's not just throw that out there like, yep, we're going to go start the office of something that's, everybody's got a different vision in their head even about what it even means.
It's actually an office, but it's not where the homeless go.
Yeah.
They're talking about having a navigation office here in Bend, and then we would have this joint office with Deschutes County. And then another thing that I'm concerned about is I wrote a letter to the governors a couple months ago about Deer Ridge. It's half empty, and I would, as a temporary basis, really want to promote opening that up as a psychiatric hospital this side of the mountain. They closed Pendleton in 2014. It was open for 101 years, and truly, most people that we talk to recognize that there are homeless people that need serious psychiatric help. So then yesterday, I heard from Gina Nichols from AOC saying that there's a conversation between the mental health directors, Steve Allen from OHA, and some legislators. And what she did have in writing is that they're thinking about putting some of the state hospital cost on to counties. Have you heard that anywhere?
I have heard that they were having conversations about doing that in partnership with residential facilities, but I've not heard that proposed in a way. It was a floating idea. I did hear in that same conversation the pushback of why would that be needed, since if you do it as a residential facility, it qualifies for the federal match, where Oregon puts $1 in, the feds will reimburse at $4. And so if it's considered a residential facility, that qualifies. And then if we do it the way they were proposing it, where it was an institutional type facility, the feds will not reimburse for that. They've moved away from that institutional type structure. And so I think there's this constant push and pull with OHA of, we don't want to set up new hospitals. We want to set up residential facilities, because then you don't have to go to partners like counties and say, now you pay for it. Not when you can have the federal leverage match available to you.
But then you're limited to 16, I believe, per some of my
in a unit. You can structure them different ways where there's multiple units on a site, but yeah, it is a 16-bed unit facility. It's just how they would classify them. I think the Wilsonville one, they just did one in Wilsonville where there's 2 16 beds, and it did qualify by CMS on the federal level. But yeah, you have to be very careful on how you do that. You're absolutely right, Commissioner. So.
Well, I'm just, we see Deer Ridge and it's half empty, and it's been half empty since it was built in 2007. It's really a lovely facility, and truly we have so many homeless here that could use, and actually other residents could really use some serious psychiatric help, and we don't have anything on this side of the mountain. So if there's any way you can see anything good happening there.
We have a monthly call. Ryan and I and our PAC West team has a monthly call reoccurring every month with the OHA government relations team. Is that a subject you would want me to just to kind of float out there to say, hey, is this an option, or to see what the immediate or initial response is and then report back before taking another step?
I did have a conversation with Pat Allen months ago, and he had said, well, his dream was to have 10 hospitals of 50 each. But that doesn't meet the federal standards, right? No. So then he has me speak to the senator who did that enormous bill, the $180 million, about building mental health facilities. And she was saying, oh no, we've got to keep it with the 16 so we get the federal funds. But we have a population that needs help. And, the decades of just letting them be on the street is truly not working. It's really cold over here now.
Well, I have no problem having those conversations and pushing for that. I also know that budget writers don't want that institutional, because I think one of the biggest drivers of OHA is that state hospital. And I'm not that it's not needed. It's just, it's almost 100% general fund. And they don't like things that are 100% general fund obligations. And so, it's very attractive to budget writers, and I believe one of those representatives that was very instrumental in that $180 million package was Tanya Sanchez, who's that new co-chair. I could be that new co-chair. None of that's final until they get in that opening day of session and vote in the speaker, but that's what they are all did their vote counts and caucus with, and she is, like you said, very big into this keeping federal dollars on the table.
But see, Phil, when you think about China Hat, and the fact that we have a couple hundred people down there, we just had a fire there the other day. The neighborhood is so concerned with what's happening, the dangers. And if we have that fire in Deschutes County in the month of July, when it's hot and dry and the wind maybe is blowing a little bit, how much is that going to cost? Remember Paradise? And, I don't believe Paradise started because of the homeless, but, it totally wiped out that community, It was something that we've been looking at for a long time. So when you talk about costs, how much did they save when they closed Pendleton? Because they just, turned it into a prison, a state prison?
It was right across from the state prison there. But yeah, I think the half of the facilities are just sitting there still, so unused. So, but well, I don't know if it's helpful, commissioners. I wanted to make sure you knew about the turnover, the political landscape, and then those big heavy lifts that they wanted to. But I guess that also just leads into knowing the timeline now is, I guess I would have 2 questions. I was hoping, I don't know if this is a good avenue to have that conversation or not, but is trying to identify what are those 2, 3, 4 things we want to try to really focus and all put our shoulder to the wheel on for the short session, knowing it's short. And then also how do we want to structure updates during this session? Is that a weekly thing, knowing that it's only 4 weeks long? What is your preference? And we will work around that and make it happen.
I do believe we have to do it weekly. It is so short. I mean, if you blink, you miss it, and there, even with, only being allowed so many bills per legislator, it still could be something that we need to pay attention to. Thank you for bringing up the egg overtime. I realize, I saw that was one of the priorities of the group. So we'll have to see how that looks. With the tax credit, you say, for the overtime?
That is what Representative Paul Hovey has presented, and he's leading that group. But he also announced that he is bringing a work group back together to start the conversation from that point of discussion. So the tax credit is in there as of right now.
Okay, it's a state tax credit, correct?
Correct.
It wouldn't be a federal one.
Commissioner Adair, just to follow up on your feedback on a weekly update, we're certainly happy to support that. I think it'd be helpful probably for both staff and Phil to maybe hear from the board if you would like to pursue an independent legislative update each week, similar to what we did last session on perhaps a Friday morning, or if you would like to have a standing legislative update as part of your regularly scheduled board meetings and just have us come to you on a Monday or a Wednesday with the time that department heads can join the meeting. So just seeking a little bit more direction on what would work well for the board in supporting this year's session.
I know, when do all the dates fall, like the 7th and the 14th and everything, just so that if we need to contact somebody or give a testimony, that we have enough heads up so that we can actually get that on our agenda and make a difference there.
And that's a good idea. Maybe Phil and I can put our heads together and come up with a calendar that might not be tied to a routine day of the week, but more tied to the timelines of the session, and try to schedule that way and bring back a proposal to the board. That's one option we could definitely consider.
It might not be as easy to keep in your, but it might be more relevant to what's happening over there.
Right.
So.
And I could see a Monday meeting, like the next 2 or 3 weeks, because this is right before it happens, or maybe it's already just 2 weeks. So Monday afternoon update, even if we don't get it real substantive, even next Monday, let's look at that. And I don't have my calendar in front of me. And then see if the next Monday works, the first week of the session. And then if we need to, because that first week of the session, everything's dropped, everything's going to be scheduled, we may need to meet again pretty quick. So that would be that other meeting that we might have to schedule, which is fine. If it's a Tuesday, Wednesday, Thursday, or a Friday, they're in that first week, let's do it.
Okay, that's great. That's helpful, and we're certainly happy to put it on the calendar.
So it's like the 21st and the 31st, those 2 Mondays. And I'm sure Phil will have some more feedback for us. And please let us know when your puppy's better.
Yeah, no, I actually really like the suggestion both Whitney and you folks have, and you commissioners just suggested tying it to the timelines, because I think if we, like, for instance, if we invited Speaker Rayfield to come and visit with you folks, I think they would feel more comfortable knowing, okay, I just passed this deadline. This is what I'm looking at moving forward, knowing these are off the table now and these are still moving. So that might give structure to legislators who are visiting with you folks too. So.
Great. Yeah, let's look for those special opportunities. As you mentioned, I was able to meet with previous speaker, Tina Kotek. Is she done now, or is it the end of this week?
It said the 21st.
So she's still the Speaker of the House. So I was able to meet with her, and then also Representative Julie Fahey about housing needs and the concept. Some of the terminology I've come up with that really is kind of the driver is. We've run out of swap space. When somebody wants to come to town or somebody's moving, and we just don't have any of that elbow room for people to be anywhere temporarily, let alone a homeless person to find cost-effective housing. So that's one of the drivers here. Campgrounds is the key to this. It's the most tangible thing that we can probably do in the short term to build some elbow room. So Speaker Kotek mentioned fixes to House Bill 2006, I think. Does that sound right? Is there a bill that was 2006 recently?
There was in this last session, I believe that was one with the Navigation Center funding included.
Okay, yeah, so that's just a catch-all for, during this short session, it could be, if there was a little change of something, it could be in reference to the bill, House Bill 2006. So that was a good reference point. But also, it sounds like this rural Oregon investment package may be a package also. I don't have answers, but, we've got so another scenario, and this is what we can talk about and share with our legislators. The KOA campground used to be a hop, skip, and a jump outside of Bend, outside of Bend, and now it's going to be the hot commercial area that just got sewer, and we're referring to the Cooley Road just north of Bend. But that is what we need. We need that next privately owned campground at the edge of town, and I'm referring to Bend specifically here, but all 4 cities could utilize something like that. So if there's just a simple land use opportunity that could be put in place, market rate campground, not low barrier, it's short-term stays, maybe instead of 2 weeks, let somebody stay there for 30 days, but that's a swap space. That's a place where people can just be for a while, short-term, without a long-term plan, but then they can get stabilized. I'm just pushing the concept of campgrounds and why. When you have a computer program and your computer locks up, it's because it ran out of memory, and swap space is the idea there. I mean, it just locks up, and I think that's what we're dealing with here. Our land use system is locking up when we don't have the next UGB. And City of Bend is exciting because we got UGB expansion that was approved that's going to be built out. So maybe this is the narrowest path right now that is going to get better in the future. But right now is a pretty rough time. So campgrounds is something that I really want to advocate for. Even somebody selling a house right now, some people are buying, when you're retired, you buy your dream RV and you travel the country. And then you come back to Central Oregon to see your friends and you don't have anywhere to park. Unless it's in somebody's driveway or in the road in front of them. So I'm just making all kinds of advocacy for campgrounds opportunities. So just keep that in mind. If there's something out there that starts to resonate or fit, even if it's not in the short session, let's look at it for the long session. If a campground could be a place possibly with electricity, doesn't have to be full water and sewer connections, because that would mitigate the long-term stay. But if it had electricity and then just a water and dump station to be able to drive by, man, people could utilize that. It could be that swap space for housing. So there you go.
Phil, are you hearing then Representative Croft's bill that was going to do up to 8 units? They're thinking about expanding that over 8. But are they going to put more money into it? Because it's really only funding for 2 out of 5 of the years. And yet it's asking for a commitment from us for to pick up those 3 years. And it would be nice to have more funding from the state for that bill. Are you hearing that anywhere?
What my reference on that was, I think, is that in his one pager he presented to the committee was that they would have 8 different pilot areas and $1 million associated with each area. So they already probably have an $8 million fiscal on that bill. And I think the North Coast is not currently one of those 8 pilot projects. So they're wanting to make sure that there's one in the North Coast, one in Deschutes County. I think they lumped all of Western Umatilla County together as one. So trying to expand it beyond that. But yeah, they would definitely, I would assume, if they're adding one, that they would expect that another $1 million would be added to the fiscal rather than diluting it down for less for everybody else. So that was what I'm hearing. I don't know if that is going to be part of a housing omnibus bill. They did drop 2 placeholders that are just related to housing, one in the Rules Committee and one in the Policy Committee. They've flat out said these are placeholders so that if we need them and we move it forward, there's a vehicle. So to Commissioner Damone, your comment there is if we see that moving, that might be a nice little amendment that we add in somewhere, or even to Jason's bill if that gets some legs. So yeah, to your question, Commissioner Adair, that's what I'm anticipating. That's just a shoot from the hip. If we add another area, they would probably just add another $1 million to it. So
okay, thank you, Phil.
A couple other points. Now I'm on a roll here, but it's just reminders. I mean, we should not be allowing tents. Tent as a tent as a temporary housing is not a good solution in the cold winter and in the hot days in the summertime. So we've always got to move past that, which gives us reason to be more serious about. We are not going to allow this for your own good, is what I'm referring to. And then, as I say, campgrounds can be that shock absorber to the system also. Just thinking about driving down the road and hitting a pothole, a campground opportunity. The state of Oregon, statewide land use system for 50 years, very prescriptive. And we've done our research on this. We have a memo from our community development department about the existing RV resorts, campgrounds, and facilities in the county. They've been withering on the vine for many, many years, and some people, if they want to upgrade or expand, they've got to go backwards for, safety and transportation and utilities upgrades that make it a huge mountain to climb. And we've just got to really get serious about that. So just dropping a bunch of concepts out there, but it all fits into the same area of campgrounds.
Well, and I think that's actually a good point, Commissioner, and not to pile on there, is with this amount of turnover of legislators, educating them early is going to be very important. And I think specifically to your conversation or your comments about housing, educating them that a one-size-fits-all isn't going to work. Winters, now this might not be the best year to say this, but winters in the Portland metro area are not winters in Central and Eastern Oregon. So addressing homelessness, homeless services, in a Portland metro lens is not going to be helpful for those folks who are trying to serve and get stabilized and back up on their feet in rural Oregon, where we have several months of the year where outdoors is not going to work in tents.
Mm-hmm,
so
Yep.
it's not healthy for them. So.
And then, so that's that whole concept of the shock absorber of campgrounds possibility. But courthouse facilities, we are truly in a spot where we're going to be executing on our big project one way or another. And if there's any capital capacity at the state, we would probably qualify with bells and whistles on that one. So, let's make sure we get education on that also. And I'll be part of the AOC Courthouse Facilities Committee. We've already followed that a little bit to help prioritize it for the Department of Justice, so they can really have a good, spreadsheet of priorities around the state. But any amount's going to be the right amount for us. The more the better, obviously, but any amount's going to be good.
Just to follow up on that, Commissioner DeBone, I know you had sent a note related to that task force and upcoming deadlines for requests for the committee's prioritization, and those proposals are due by noon tomorrow, and so Lee Randall has prepared a draft for the board's consideration that we're happy to bring to you under other items today so that you can take a look at that in advance of the upcoming deadline
Great.
related to that committee's work.
Yeah, thank you very much. And so that's going to be discussed yet today. It'll be a one-pager or whatever it is, explaining our need and putting our, asking to be on the spreadsheet, whatever that looks like.
Correct.
Okay.
But Phil, when we got our 2 judges, did we say we had the capacity not to ask for funding?
We did say we had the ability to construct, we did have the funding for construction. We went back and asked LFO about the budget note that they included on that. That was more for internal purposes rather, I think, and I'm summarizing from the hip here, where they've said, we just wanted you to folks know that the funding we allocated in the last must be used on the judges and not the courthouse. So it doesn't prohibit us from going back and asking for courthouse funding if needed. I would also contend that there's that delicate balance of, do we want to go play outside of the courthouse DOJ program? And if so, and they introduce a rural Oregon package bill, I would say that wasn't an option on the table either when we were talking. And so maybe including something in there would be, it was not the same table that we were talking about before. There was no rural Oregon package previously. And if they're interested in making capital investments to just get dollars out into rural areas, this is a safe project for them in the sense of it's going to have public oversight. It's going to be serving Oregonians and things like that, and ideally helping save costs in other areas. So that was how I would answer that question if Ray Field asked, and I think that would land fine. So.
Well, and I would always acknowledge that, this is a facility that's going to be built. So there's one-time costs, and then there's the long-term operations and maintenance and upkeep. So, we're operating and maintaining. We're hosting the court system in that facility. We're paying for the deputy DAs in the next building over. So we're taking on a lot of long-term operation and maintenance and even staffing for the whole public, the court system and the deputy DAs also. So, I don't feel bad about saying, hey, one-time funds, let's go. What do you got?
Well, and I think one of the conversations to keep in mind is there has been especially with the ARPA funds, on the projects that were funded by ARPA funds by the state, they attached apprenticeship utilization standards where they're trying to use these opportunities to at least replenish the construction workforce in rural areas. And I'm shooting from the hip here, commissioners, I believe it was 10 to 15% of construction hours, union or non-union, both sides have apprenticeships, would just have to use apprenticeship on a portion of those construction hours. My understanding is having contractors sign up for that's not overburdensome. It's a 1-2 page form, but it allows you to start getting training and apprenticeships as the construction industry starts to retire. This is helping keep rural construction crews. So I think I would not be shocked if they would ask us to agree to that. But I also wouldn't be shocked if they start just mandating any capital construction allocations must use apprenticeship utilization. So that's another thing we could put on the table, saying before that wasn't an option. You're making actually 2 investments by this and helping the construction, but also if there was apprenticeship utilization, we're helping with workforce as well.
Yep. Well, and apprenticeships are exciting, and we all understand. I mean, there's going to be we do have construction coming around, especially in Central Oregon. So we'd already talked about that a little bit here, and we wanted to learn more. In fact, we had scheduled that out for ourselves because Central Oregon Community College is, working through the projects of what BOLI certified apprenticeship programs can be hosted here in Central Oregon. So, as I say, part of it is education, just getting the facts out on the table, but understood, that's pretty exciting.
Well, I will definitely be getting this Excel list of priority bills that have been introduced thus far with my notes onto the side over to Whitney and the team and Nick for first review, so that we're not putting the whole thing in front of you folks and having some bills that just aren't relevant and taking your time. But if there's anything else I can be including those, I'm happy to do so.
Thank you, Phil.
Thank you very much.
All right. Thank you.
Okay, Cody, are you available? Okay.
Here we go.
There he is.
Sorry about that. I had to log back in there and I didn't hear my introduction, so I missed my mark.
Oh, that's okay.
So for the record, Cody Smith, County Engineer, Deschutes County Road Department. The Surface Transportation Block Grant Program are federal highway funds that are administered to ODOT, and through the joint ODOT AOC LOC working agreement, ODOT allocates a portion of those Surface Transportation Block Grant funds, or STBG funds, to cities and counties in the state. How this has typically happened in years past for us is on an annual basis, we enter into an agreement with ODOT to fund exchange our Surface Transportation Block Grant funding allocation, where we assign it to a particular project that we're delivering in that year. And then ODOT fund exchanges those funds, so they convert those funds from federal dollars to state dollars and then gives those funds directly to the county. Under those prior agreements that we've done in years past, when that fund exchange was occurring, ODOT would exchange those funds with us at a rate of 94 cents in state funds for every dollar of federal funds. Moving forward now, ODOT has decided to do this in a different way, and the ODOT AOC LOC working agreement has been updated to reflect this. The way that this fund exchange will now occur is through one agreement with each individual local agency that will cover the entire ODOT STIP cycle. So STIP is the statewide transportation improvement plan, and the current STIP cycle, ODOT's current STIP cycle runs through federal fiscal years 2021 through 2024. So the new program now, one agreement that covers the entire STIP cycle, and on an annual basis, if the county or city is electing to fund exchange their STBG allocation, all they do under that agreement is send a letter to ODOT on an annual basis to ask for those funds, and those funds are distributed. Alternatively, and this has always been the case, instead of doing that fund exchange, local agencies can assign those funds directly to a federal aid project that's being delivered by ODOT. So with all that, before you this morning is this new updated agreement with ODOT for fund exchange for our surface transportation block program funding for fiscal years 21, which would be last fiscal year, through federal fiscal year 2024. And again, under this agreement, instead of entering into a single agreement every year on a project basis to receive this funding every year, with this agreement, covers us for the next few years. We just send a request letter to ODOT every year if we choose to fund exchange our STBG allocation. Currently, we have about $1.7 million in STBG funds in our balance with ODOT that we have not yet requested or obligated. That's our funding for federal fiscal years 21, as well as the current fiscal year, federal fiscal year 22. So this morning, we're requesting that the board execute this new surface transportation block grant funding agreement with ODOT that will allow us to proceed with that fund exchange as we choose for the remainder of this STIP cycle. However, I do want to note with this is that with that current balance we have of STBG funds, about $1.7 million, the road department is proposing that we actually don't request a fund exchange for that funding, that we instead use that funding as part of our anticipated $10 million contribution to the Terrebonne, the US 97 Lower Bridge Way improvement project. That project will be we're currently working on a draft intergovernmental agreement for that project with ODOT, and we, the road department, have asked ODOT to include language addressing that in that draft agreement. So what that'll do is, instead of that current $1.7 million that we have in our deposit, if we were to fund exchange it and just receive it as cash, 10% of it would be kept by ODOT at that fund exchange rate. However, if we're applying it directly to an ODOT delivered project, we don't have to fund exchange it. We don't lose that 10% of the funding. So with our current balance, that's what the road department's going to propose to do when we present that the IGA for the Terrebonne project to the board here in the coming months. But that said, for fiscal years 23 and 24, we with the budgeting process, we may want to consider instead doing the fund exchange to receive our STBG monies on an annual basis. And the anticipation is at the end of this STIP cycle, we would enter into a new agreement with ODOT for subsequent STIP cycles. So with that said, I'll pass it back to the board chair and happy to answer any questions.
So Cody, so the bottom line would be then that instead of Deschutes having to come up with 10 million, we'd come up with $8,346,405. Is that what you're saying?
Yeah, in county.
Somewhere in that
funds.
neighborhood.
So it would be, so out of that full 10 million, it'd be, roughly $1.7 million would be our STBG balance, and then the remainder would be in county funds that we would pay to ODOT, yes.
Okay, and so we're not talking about 2023, we're just talking about 21 and 22. And
Correct, our current obligation, we can't
go ahead.
obligate our future allocations, because those haven't technically been calculated yet, and they haven't been received, so.
Okay. All right, is there any other questions?
Well, great. So the observation is these are for projects on the capital improvement plan of Deschutes County either way, correct? I mean, so this
Correct.
CIP partnership for Terrebonne or a CIP project anywhere else in the county, that's probably the only use of these dollars, is that?
That's correct, yeah, these monies have to be used on roads that are on the federal aid system for projects or programs that are on the federal aid system. So in our case, what that generally means is a road that's functionally classified as an arterial or collector road.
Yep, great.
So, yeah, for us to do that, we could either use them on one of our own CIP projects, and when in doing that, we have to fund exchange to receive those funds as state dollars, or if we have a joint CIP project with ODOT that ODOT's delivering, we can just assign those funds to that ODOT project and not fund exchange it.
Yep. What a great opportunity. Yeah, I mean, with that, I'll move approval of the document 2022-085.
And I'll second the motion. Any further discussion?
Nope.
Commissioner DeBonne?
Yes.
Yes, and the chair votes yes. So thank you, Cody. It sounds like good news. We didn't have to lose 10%, which
Yes.
could have been significant, right? And it's a big project, and I know that Crooked River is waiting for that intersection to get done. So they've been waiting quite a while. So thank you.
Thank you.
All right, so now we have the public health modernization funding.
People are coming in from the outside of the thing. So Tom Kuhn, we're getting to the next item. Public health modernization funding.
There he is.
Hello, I believe Cheryl Smallman was also going to be joining us. She is not. She's in the waiting room.
It says Nahad and you on our outline, Tom.
Yes. Okay, well, I guess it's, for right now, I guess it's just me. But anyways, I had met with all of you approximately late November to discuss our modernization application for funding, both local, regional, and some one-time ARPA support funds. And we submitted our application. We also had your approval to apply for these funds. And we did so and were awarded the full amount that we applied for. So that was great. And it's now at this time, we are looking for approval to increase the appropriation and FTE and Health Services Fund. And I believe you see on your agenda request, it relists the positions that we were going to apply for, some existing, some additional. The one thing I did want to mention is that on the agenda request you have, that is in a slightly older one. We updated it, but evidently it didn't make it to your packet. We are actually only requesting 4 new FTE and 5.2 existing FTE. So there's a little discrepancy in that. However, in the budget adjustment document, that is in the packet. It is accurate with only 4 new FTE versus the what's listed on the agenda request.
But I know public health modernization has been an effort of the public health, department, but around the state also, just getting that base level of service for all people. Obviously, we're in a public health pandemic situation, but this is bigger than that, or longer term than that, as in just providing that epidemiological support. Ooh, I might have said it right. And the staffing for just that the overall blanket public health of everybody. I do see this as the core mission of, really optimizing the population health, referring to 100% of the people. So pretty exciting that the state's getting a little bit of a funding scenario around this.
Yeah, and I anticipate this will be sustainable funding in the future. They say currently this is for now through June of 2023. However, there's been a big push at the state level to keep this funding sustainable. It might come to us in a different form in the future. Instead of saying modernization funding, it may just come through some of the other program elements that we already have existing, but it would be the same type of work, just with a different label from where the funding comes from. And I think that's ultimately the legislature's plan for this funding.
Mm-hmm.
Okay, Tom, I wrote your quote down so that when we look at this in the future, we see that it does have funding. If the state, if the state truly is going to do this. Honestly, after COVID, what is it, almost 2 years now, I really, really wish the state would have done more for our hospital beds because Oregon and Washington State have the fewest beds per population of any state in the country. So I appreciate they're modernizing part of it, but honestly, maybe we should have added a few more beds.
Yes, no, definitely something that we need to keep in mind for sure in the future.
Well, especially with our population in Central Oregon on, the way up, and it seems to be that it's been that way for quite a while now. So hopefully that's something that our hospital systems can work on, because I do believe we need more beds. So do we have any other comments?
No, I'll make a motion to approve Resolution 2022-001, increasing the appropriation and FTE, referring to 4 new FTE in the Health Services Fund.
And I will second the motion.
And I'll acknowledge this is a time of growth in our FTE of the county, and I've said this a little bit. We want to manage growth as it's coming. These are funded positions, obviously, but this is that time where we're building out some buildings. Up in Redmond now for the health department, we're adding a few more FTE here. Population is growing also. People are moving to Central Oregon, so we're growing the system appropriately at this time.
So, Commissioner DeBonne?
Yes.
And the chair votes yes.
Yes, thank you very much, and thanks for your support over the years for modernization. As we've done quite a bit of legislative work in support of modernization funding, which really has helped us get this point in time. So thanks again.
Great, thank you.
Right, that we got 100% of what we asked for. So good job.
Thank you.
Okay, do we have any other items at this moment?
Just that other item that was already mentioned, the Court Facilities Task Force. I know Lee Randall may be, or I don't know if he's coming to join us, but Nick?
I had coordinated with Whitney, and I understand that Lee may be here or be on his way.
So I'll just fill in. So there was an email. It's the AOC, Association of Oregon County Court Facilities Task Force, and we already spoke about this a little bit, Commissioner. And it was an email was just saying, if you have ideas or asks, please put them on the record. So this is that moment in time. And it's just come one, come all, put information out there to see what can all be put on the spreadsheet. As I say, these are the one-time capital funds, and I don't feel bad making sure we raise our hand again and say, oh, yep, we're building a big project. Because there's new courthouses around the state, but there's also courthouse expansions and upgrades and fixes. So we can kind of qualify for whatever's appropriate there, whatever the line item might be. So I haven't seen a memo yet.
They're on their way.
Yeah, okay, good. No rush then.
Any other items?
I didn't bring anything else today, no.
I did, Nick was on the call for a moment in time last night for the Heart of Oregon for their ask for the community. So I did watch that presentation last night.
Great.
And I did go to their grand opening ceremony also last week in Redmond. And it would really be nice when people have directions that Google misinterprets, that they so know the directions are misinterpreted. Because, yes, the superintendent of Sister School and I kept waving at each other at the wrong side of town. I kept thinking, why am I going towards Sisters when I should be going towards Prineville? Yeah, no, it was truly, and they said, oh yeah, it always does that. And I'm like, well, maybe on the invitation they could have designated don't follow Google.
I did that. Upas Avenue is short road on one side of town and a short road on the other side of town. And man, I was on the wrong side of town. And to get to the other one, you got to zigzag all through town to get to the other side. And it's named the same. And if you look at a map, it makes sense. But they are way on the other side of town.
I know. It's pretty, anyway. But it was, Curtis drives a Tundra too. So it was really, we were like, well.
Well, and Heart of Oregon Corps, remember, I mean, that was started through our juvenile detention efforts many years back. So that Deschutes County was one of the founding members of that whole effort. And it's a wonderful opportunity for alternative education and experience, summertime crew work, construction, and GED work.
And they're actually working on a child care center. They have a room committed to childcare, and they're going to be doing that. So, I think our childcare, if we have people that are going to participate, hopefully it's going to be expanded upon shortly.
Yeah,
so between that and the program at COCC, which hopefully has, their 28 students this semester. So great news. Thank you so much.
I was scheduled to join that too, but I had my COVID experience last week, so wasn't going to be making it.
And then I did meet with Don Senecal. He just was awarded the 3-shower tractor, and so that should be arriving, I believe, the end of this month. So more community support. It was great to meet with him. And he definitely agreed with me that if we could do something at Deer Ridge, even if we could only add 16 people there, I mean, it would kind of be, they'd be lost because it's an enormous facility. But if that's what it takes, at least start with 16 and start helping people that truly need psychiatric help. Lee, are you available?
Yep. Yeah, we're ready. We were just filling in with other conversation at this point in time. So I already made the kind of introduction, the fact that there was an email that's the Association of Oregon Counties Court Facilities Work Group. And thank you very much for preparing for that, because it was an email that, I don't know, had you seen that previously? Mm-hmm. Okay, good.
Thank you, Lee.
Thanks, sir. Thank you.
And then I also have to reference the frequently asked questions that were provided by OJD and DOC and AOC, sorry.
Okay, yeah, so this is a recent response.
Thank you.
And I think as well in this packet is kind of the criteria list at the end.
Well, this has some of the terminology, so providing suitable and sufficient court facility remains a statutory responsibility of the county, so just seeing those words in there reminds you the scope of what we're even doing.
You have the floor.
Okay. For the record, Lee Randall, Facilities Director. So what we provided is a draft, which is a update of a similar memo that was provided in 2019 to the task force, the Joint Judicial Department and AOC, Association of Oregon Counties Task Force. So we have this for your review and any comments that you may have.
As I say, just anything, getting it on the record is going to be wonderful here, and I'm looking kind of towards the end of it, referring to estimated cost for this project is 27 to 28. And that's, I'm sure, inclusive of a lot of the big picture here. Wasn't long ago we were talking 21, 22 maybe, so it's already slipping up.
So is it considered that there are no state offices in that building, and it would be a 25% match? That's on page 2 of the questions.
It would be, I would expect that that would apply, that the match would be less than 25% due to not planning at this time or having the space to co-locate other state offices.
But still, that could be a significant amount of funding, couldn't it? If we're looking at 27.5 million.
Correct, yes.
So yeah, I mean, this memo's going to do what we want it to do. Let's make sure it has a date on it. I see it doesn't specifically have a date, because this is just a point in time, current estimate, where we're at with the, owner's representative firm and the RFP for architectural and engineering team. So just saying, as of today, as of this
Do
date.
we sign this memo, or do we accompany it with anything?
My understanding, and Commissioner DeBonne, feel free to chime in, from the email from AOC was simply that we would submit by email, and I think we could certainly give a finalized version to Commissioner DeBonne, or staff could support in doing that.
I think anything's good. This is a placeholder. It talks about, the amount of money, the scope of the project. This is the placeholder we want to be put in. So I'm very supportive of just this document in this form. We don't need to sign it at this time. This is just making sure we have a placeholder in the state conversation. But you could sign it as the chair if you'd like.
Certainly, we could adapt the draft. We're going to need to remove the watermark, so.
Yes, I can see that.
We could do that if you'd like.
No, I just thought it might look a little bit more official if someone has their name on it.
Yeah, well, let's do that, though. And then I'd support a chair signature, just so it's one of us. Doesn't need to be such a big thing. So, to formalize it, I'll move approval of the county position paper for Deschutes County Circuit Court Edition and chair signature.
And I'll second that. Any further discussion? Lee, I would just move where it says proposed project on the bottom of the first page, and I would bring that over to the top of the second, because you still have room to drop that down a little. It'll just look better. Commissioner DeBonne?
Yes.
And the chair votes yes.
Thank you so much.
Thank you.
Could be worth some money. And I've offered to be on that court's committee with the other AOC commissioners from around the state. AOC President Murdoch, I think, is going to do some appointments. So I just offered to be on it. I'll see if he selects me. But I think they mentioned that they're looking for the next person or two to be involved.
Okay, sounds good. Do we have any other updates, Nick?
No other updates today. There are some topics we can discuss in your retreat tomorrow, such as a potential budget committee vacancy coming up, and other updates we can discuss tomorrow.
Okay. Dave, did you have anything? Okay. So, technically, it worked. We're
Yeah,
full
we got
hours.
it
Thank-
working.
Thank you, Morgan. Good job. Thank you. We'll now adjourn our meeting, and we will be at our retreat tomorrow morning at 9, and it will be covered. Correct.
Yes.
Good.
Recording stopped.